welcome to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook. Thank you for joining us here at the Campus for All Animals, the Houston SPCA. I'm so glad to talk to you guys today. I want to talk to you guys a little bit about first aid for your pet. So there's so much that happens on a day-to-day basis. Our pets are out with us playing in the park, sometimes in the backyard, sometimes just at home, and occasionally they get injured. And so we'll try to help you figure out what you can do to help your pet before you can get them in to see your veterinarian in the event that they injure themselves. So be thinking about your questions. Hopefully I can give you a little bit of assistance. And in the meantime, I want to introduce you to our wonderful of the week. His name is Malcolm. Malcolm is about a 1-year-old male. He's neutered. He's a lab mix. Malcolm is shy and somewhat timid, but he warms up really quickly. He's one of our playgroup pals, and so Malcolm actually really comes out of his shell when he's around other dogs. He does really well, loves to run around in the park with other dogs, so that's great if you have another dog that's not too pushy, but that might be a good mate for Malcolm. And Malcolm also, really loves people. He's one of our punts for pals. So what that means is his adoption is sponsored. So if you come and visit with Malcolm and you feel like Malcolm's going to be a great pet for your family, then his adoption fee will be covered. So we thank Texans punter Cameron Johnston and his wife Tia for sponsoring Malcolm and all of our other Punts for Pals dogs. So thank you guys so much for joining us. And so today we are going to talk a little bit about first aid. So does anybody have any questions about first aid in their pet?
So what should we have in our first aid kit, and how is it different than like the first aid kit we have?
Okay, so if you're trying to make a first aid kit for your pet, the good news is you can find some first aid kits that look like this, Pet First Aid. You can buy them commercially, and they're sort of already stocked for you. But some of the important things that they have in the first aid kit are, first of all, you want to make sure that if you're handling your pet and they've got an open wound or a cut, that you're making sure your hands are clean so that you don't introduce any bacteria onto your pet. So they have things for you to clean yourself, hand cleansing cloths and gloves, because again, if you're treating a wound for your pet, you want to make sure that you wear gloves, that you protect yourself from any blood, and that you are not introducing any bacteria into your pet's wound. Then there are other bandaging type materials that can help you place a bandage on your pet in the event that he or she gets a minor cut or scrape and you want to bandage it prior to taking it to the veterinarian, taking your pet to the veterinarian. Now, this is going to be important if there's bleeding. There's active bleeding. That is a clue that you want to put a bandage on the pet. And so in your pet first aid kit, there will likely be materials that you can use to clean the wound. And so there could be dilute betadine, for example, like iodine. If there's not in your first aid kit, you can get betadine or iodine from a local pharmacy. But you can also just use warm water to clean a particular wound. And so you want to make sure the wound is clean. But if it's bleeding, even if you clean it, it may continue to bleed. In that case, I want to talk to you about how to place a wound on the paw or on the limb of your pet. So we're going to do a little bit of a demonstration here with Malcolm so that you can see how we would place a bandage on a pet. But this is going to be a little bit simpler so that you can do it at home. So ideally, if your pet has a wound, particularly on the paw, if there is a second person to help you, the first thing you want to do is make sure that you have a partner. One of you is going to be the restrainer or the person who's comforting Malcolm or holding the pet. The second person is going to be the one who's applying the bandage. So in our case, we have Jessica, who is helping us to restrain Malcolm and make sure he's calm and petting him. And then we have Lisa, one of our veterinary technicians, who is going to apply a light bandage to Malcolm's paw. If he'll let us, it's just going to be a light bandage for demonstration. If you have a pet who you think could bite or has been known to bite, or the paw is painful and so they're wanting to bite, you can actually make a muzzle. If you can purchase actually a muzzle online, or you can get a muzzle from a pet store. Sometimes they have these sort of mesh type muzzles that create a lot of airflow. You can get muzzles that are actually kind of cute that look like ducklets. So this is actually a cute little muzzle there. That's what it would look like. So that's a fun one. But if you don't have an official muzzle, like one of the ones that we see here, then you can also make a muzzle from a leash or a leash that you have. So if you have a leash, one like we have here, you can actually wrap this around your pet's muzzle and just tie a knot in it and tighten it over your pet's muzzle. It doesn't have to be super tight, but you certainly want it to be just tight enough where they aren't able to open their mouth wide. If you don't want to use your leash that we have here, you can also use gauze or maybe even a large t-shirt. So you can use stretch gauze that comes on a roll like this. And you can use this to tie around your pet's muzzle as well. Like this, or you can use like a t-shirt. So those are ways that you can, one, keep your pet comfortable, prevent injury, and hopefully get some restraint happening. Now, for the paw, the first layer that you want to put on a bleeding wound is gauze. So you can get gauze. It's going to be in your first aid kit, or you can purchase it on your own. So Lisa has applied some gauze. Malcolm's not liking his bandage, so we'll see if he'll tolerate it. If not, we'll let him go. But you want to first put some gauze on. Then you want to take your stretch gauze or roll gauze, like we have here, and you're going to use this to wrap around the square gauze. So the square gauze is an absorbent layer. The good thing about square gauze is that it absorbs the blood, but it doesn't stick to the wound. It's very soft and absorbent, and it's not going to be uncomfortable for your pet. You're going to follow the square gauze again with this also soft roll gauze. It's very soft. It should be very comfortable, not too restrictive or constrictive. And so you can follow that square gauze with this roll gauze. The next step is going to be taking some self-adhesive bandage material, like we call it vet wrap, but some people call it sports wrap. You can get it from your local pharmacy, and this is self-adhesive. So when you wrap this around the roll gauze, and it will stick to itself. You don't want to put this on too tight because it can shrink and tighten the longer it's on. So you want to make sure that when you're putting the vet wrap on, that you put it on nice and loose and not too tight. So that's vet wrap. We'll see if Lisa's getting some vet wrap on right now. And usually, this stays on quite well. But to help it stay on, having some self-adhesive tape will also be very beneficial to put around the edges of the bandage so that it doesn't slide off during transport.
If someone's dog or pet has kind of longer hair, do they need to shave that before putting a bandage on?
So the question is, do you need to shave the hair? In an emergency situation like this, I would not try to shave. Part of the reason is you're hopefully going to get your pet to the veterinarian right away. And you don't want to make your pet so nervous or so scared that you're doing more damage or that you are making them more stressed out. If they've already suffered an injury, sometimes the noise of the clippers can actually make them a little bit more anxious, and the feel of the clippers on their paw might make them a little bit more anxious. And in some cases, the clippers can cause razor burns or cuts. So, I would not worry about doing too much at home, but take your pet to the veterinarian and let them do it. We will definitely do that when we get your pet into our care.
If we don't have any of the kind of recommended products you mentioned for cleaning, can anybody use soap, hydrogen peroxide, alcohol, anything? Are there any other household alternatives in a pinch?
Right. So what do you use to clean the wound? Well, this is an interesting question because for ages, we have all considered hydrogen peroxide a good chemical to use to clean wounds. We often use it on ourselves, and we may even use it on our pets. But there has been new evidence to show that hydrogen peroxide can actually inhibit healing. So it can actually inhibit the cells that the wound needs to try to heal itself. So we don't recommend using hydrogen peroxide as a chemical to clean wounds initially. You can use dilute iodine, or you may be able to go to your local pet store and look for chlorhexidine. Both are antibacterial and can help reduce bacterial infections and are safe and will not inhibit healing. So great question.
And then another question that came in is, one is like, are the bandages the same as humans? And then are there times when we shouldn't bandage?
Yeah, so the bandages are essentially the same materials that you might use in human medicine. So the gauze is the same. We got this from just a local pharmacy. The wraps are pretty much the same. So the materials are the same. And oftentimes the way that we bandage is the same as well. But I would say there are times that you may want to bandage and times that you might not want to bandage. So always contact your family veterinarian. If there's excessive bleeding, we certainly want to bandage that because we want to stop the bleeding. Excessive bleeding can lead to life-threatening conditions. So try to get a bandage on. If the bleeding seems excessive, you can also place a temporary tourniquet on your pet. So if the bleeding is on the lower half of a limb, for example, what you want to do is get material like we see here, a leash or stretch gauze, and you can tie this around your pet's limb closer to the body, between the body and the cut. So if you have a really terrible bleeding cut on the paw, it's bleeding a lot, what you want to do is you want to interrupt the blood supply to that cut. And so you want to put the tourniquet between the cut and the body, and then get your pet to a veterinarian right away.
And then I've heard there's a myth that the dogs, licking their wounds is going to help it heal faster. Is that true?
So yes, we've heard that for ages as well, that licking the wounds, when the dogs are licking their own wounds, that's helping it to heal faster. Well, dogs are licking their wounds because it's uncomfortable and they're nursing it and they're trying to make it feel better by nursing it. But this happening too often will actually inhibit healing as well. We do not want the constant irritation of the tongue, because what it will do is it will prevent whatever clots have built up or whatever initial cells that are starting to heal. It may remove those healthy cells that have moved in and those clots that have moved in. So we actually want to prevent our dogs from licking too much. It may happen where they're licking initially, but if that happens over a period of time, we can actually inhibit healing.
So then that's our next question. How do we stop, our dog from even ripping the bandages as well?
Oh, yes. So there's a couple ways that you can stop your dog from licking or chewing at an injury or at the bandages that are protecting the injury. The most fun one that we all love is the e-collar, the Elizabethan collar. So the e-collar is what we call the cone that you might see dogs walking around in, a plastic cone that looks like a lampshade over their head. Some dogs tolerate this really well, others don't, and they'll try to get it off. But this is a really good tool to use to prevent your dog from licking at an extremity. You just have to make sure that it fits well, not too tight and not too big so they can't take it off. If the e-collar does not work for your pet, your veterinarian may be able to suggest products that you can use to spray the bandage material that will prevent your pet from licking. For example, this is what we call bitter apple spray. I can spray this on the bandage that I placed on Malcolm, for example. Oh, that looks like a beautiful bandage. Good job. So we could spray this on the bandage, and it tastes terrible when the dogs try to lick at it. And so this could be a way to prevent them from licking at the bandages.
And how often should we change the bandage?
Yeah, that's a great question too. How often should you change the bandages? Now, hopefully by now you have contacted your family veterinarian, because we need to determine how severe the wound is, and that will help us to determine how frequently to change the bandage. So there are some bandages that we might be able to go every couple of days before changing, and there's some that need to be changed daily. Usually we change them more frequently, the more discharge that's present. So if there's active bleeding, or there's pus, or there's material that's draining from the wound, those need to be changed more frequently than a wound that's drying up. And your veterinarians can do lots of work to help these wounds heal faster. We have some wonderful products that can help wounds heal faster. For example, honey. Honey has some really, really good properties to actually help wounds heal faster. We oftentimes will use products like sugar. or antibacterial ointment. There's lots of great products that your veterinarian will have that will help to get those wounds healed faster. So if you're wondering how frequently to change the bandage, please have it examined by a veterinarian first to determine the frequency.
And then what are some signs indicating that there's an infection? Is pus normal, or is that a sign of that it's going wrong?
Yes, if you're seeing green or yellow discharge, particularly if it's foul smelling, this is definitely indicative of an infection, and you should get your pet to a veterinarian, and likely they will prescribe some antibiotics. So yes, signs of infection would be foul odor, green discharge, yellow discharge, sometimes brown discharge. Oftentimes the skin will also look very moist and wet, and we don't want this. We want those wounds to dry up so that they can heal. The moisture, bacteria love moisture, love dark environments, so we want to make sure we keep wounds clean and dry.
And then how long do wounds typically heal? Like ranging from a small cut to a space surgery?
Yes, that's a great question. And oftentimes it depends on maybe how deep it is and which layers are affected. So there are some small wounds. For example, when we do cat neuters, the wound that is created after we complete a cat neuter surgery can be closed in about 3 to 5 days. They actually close up really quickly because the wound is just through the skin and the subcutaneous tissue layers. And so those heal pretty quickly. However, you can certainly have wounds, particularly if they have infection or that went deeper into the muscle, for example, that take longer to heal, sometimes up to 2 weeks. But most wounds will heal in about 2 weeks unless there's significant infection or they're affecting deeper layers like muscle layers.
Somebody asked, their dog is scheduled for an amputation soon. What should they expect?
Yes, amputations are unfortunately something that your pet may have to have if they've had a severe injury to a limb. The good news is that when an amputation is performed of a limb or of a tail or sometimes just of a toe, the remaining wound is really just the skin and the subcutaneous layers and sometimes the muscle layers that need to heal. And so they oftentimes are healed within 2 weeks. As long as there was no, again, infection that was complicating healing, oftentimes these wounds heal up very quickly within 2 weeks. That's typically the time that we take out sutures or staples. We leave them in from 10 to 14 days. For most cases, at 14 days, these wounds are healed. So even though an amputation is a serious surgery, the healing process can be pretty quick.
And then can you remind us again, when should we visit the vet versus like a small cut in the backyard versus like we need to, do some extensive wound care?
So monitoring is going to be key, monitoring. So you want to make sure that if there is extensive bleeding, please see the veterinarian. So if you are not able to stop the bleeding, and you would know because most bleeding will stop within about 3 minutes. So if your pet is bleeding, you can take the gauze square. You can apply the gauze square to the bleeding area and try to hold it there for 3 minutes. That's about how long it will take for blood to clot and for the bleeding to stop. So it should stop within 3 minutes. If you're noticing that's continuing to bleed, or if you're putting the gauze up to the bleeding spot and you start to see blood soak through the gauze, then that's excessive bleeding, and I would say take your pet into the vet right away. If you notice infection, again, a foul odor, yellow-green discharge, that would be a sign to see your veterinarian. And if you're noticing that the wound is getting worse or not healing, so maybe you thought it was a mild cut, and so you didn't take your pet to the veterinarian, you just cleaned it and watched them, but maybe the next day it looks bigger or worse and your pet is limping. Maybe the next day it has discharge. If you notice it's getting worse and not better, those would be signs to see your family veterinarian. Well, thank you guys for joining us. I know it's really quick. We've got lots to talk about as it relates to pet healthcare, so we're always looking for topics. Please feel free to send us a message if there's something that you want to learn about as it relates to your pet. Please join us here on our campus for all animals. Come down this weekend to our adoption center. See all the dogs and cats and puppies and kittens that we have available for adoption. And if you can't make it down this weekend, please put on your calendar October 28th. October 28th is our annual Halloween ball. And you heard it right, Halloween ball. It's our wonderful soiree that helps us to celebrate all of the wonderful work that we do here at the Houston SPCA. It's a time that you can purchase a ticket. You can come here. We are going to be in elegant Halloween costumes and cocktail attire. We will have dinner, and we will have dancing, and we will have drinks, and we will have animals, and it'll be fun. So please come down and join us. If you're interested in purchasing a ticket for our annual Halloween ball and fundraiser, please go to HoustonSPCA.org, and there will be a pop-up for the Halloween ball, and it will lead you to purchasing tickets there, and come have fun with us, be a part of our family. We thank you so much for joining us. Please come down and meet Malcolm. He's been so patient for us today. He's a great dog. So come on down and see him and all of our other pets. And we will see you next week here at the Houston SPCA. Bye-bye.